It's shortly after 9 p.m. in Doha. Hello from the newsroom of Northwestern University in Qatar. Wherever you are in the world, wherever you're watching from, welcome to the Agora, the final live session of day 3 of Wish 2020. Everyone's gone home. You just heard Folly say goodnight. So we've been left alone here to make mischief. If you're watching this, it essentially means you're one of the cool kids. So what is the Wish Agora? The Wish Agoras are based on gatherings held at ancient Greek assembly places where communities would gather to share news and exchange views. Introduced at Wish 2018, this year we've moved our Agora conversations online because, well, 2020. I'm Nick Bradshaw, Director of Outreach at Wish, and I'll be moderating today's session, which I hope will be both informal and engaging, and which posits the question, how did we let the wearing of masks become political? For decades, centuries, surgical masks have been worn by healthcare professionals around the world. In countries like Japan and Singapore, it's standard to wear a mask in public if you feel unwell and you think you're at risk of spreading disease. This year, as the novel coronavirus spread around the globe, more and more public health bodies advised that the wearing of masks to stop the spread of COVID-19, with the WHO joining calls to mask up in public in areas where social distancing isn't possible in June, having previously argued that there was not enough evidence to say that healthy people should mask up. But now, not everybody agrees with this. Not everyone agrees that it's the right thing to do. In some parts of the world, not wearing a mask has become a political statement as well as a public health issue. With me tonight is Professor Ivo Vlev, a member of the Behavioural Science Group at Warwick's Business School over in the UK. Ivo is an expert on not just the way we behave, but also how we can be nudged into behaving differently. Shortly, we'll also be joined by a panel of 12 members of the Wish community, who I'll bring into the conversation in a few minutes. But first, I'd like to speak to you, Ivo, to help us get an overview of the topic we're discussing tonight. When it comes to wearing masks, why do some people comply but others don't? How has it become the case where in most parts of the world, many parts of the world at least, that what appears to be a personal aspect to our response to COVID-19 has actually kind of turned into a mass response, often one that's politically driven?
Well, luckily, we can answer this question by getting some data from the Imperial College London COVID Behaviour Tracker, which has been conducted for a few months now. This is the largest COVID health behaviour survey study of its kind in the world. To date, we have more than 400,000 participants in 29 countries with 42 million data points on behavioural, social demographics, comorbid chronic conditions and self-reported symptoms and so on. Thanks to YouGov, they provided the data for free. And the tracker now has shaped the way that both World Health Authorities and World Economic Authorities track and model COVID consequences. So what have you learned from this tracker? You can find it online, but just give you in a nutshell, the summary points. We show willingness to improve our behaviors, but our actions don't always match up. For compliance, law persuades more than messaging on key behaviors. So legal consequences are really crucial around the world. About our response to COVID being politically driven, the tracker shows trusting government and trusting health authorities is associated with health protective behavior, such as wearing a mask. And what we also learned from the survey is that COVID-19 is global, but one-size-fits-all solutions doesn't work. The global pandemic has highlighted national and cultural differences in responses.
What's the impact of people wearing masks on other measures being recommended by public health authorities? I mean, I'm thinking things like social distancing. I know that you've been involved in some research around that.
Well, what we find from the survey again is there is large regional variations in this. So how frequently Europeans report carrying out protective behaviors, for example. The most adhered to preventive measure is hand washing, but there is a large variation in Europe. The most striking example, with 4% in Sweden report wearing a mask compared to 96% in Spain. In some countries, there's a correlation between health protective behavior, including mask wearing and other behaviors. For example, take Spain. mask wearing is correlates with washing hands and keeping social distance. In other countries like Sweden and Norway, hand washing is adhered to, but not mask wearing. There's a wide discrepancy between these two different types of countries in terms of who wears mask and whether mask is also correlated with other behaviors such as hand washing. Quite interesting study that we conducted at Warwick about the impact of face mask on social distancing. So wearing masks can actually adversely affect attitudes towards social distancing, our study shows. We found out that participants prepared to stand closer to others while wearing a face mask, and they also would like to stand closer to other people who wore masks. And those who felt a greater risk are likely to maintain a greater distance. So in this case, those who believed face masks are effective at preventing the spread of COVID-19 were more likely to relax the distance if they or the other person were also wearing a mask. So our results could be particularly relevant for countries where mask usage is now low, but social distancing guidelines have been relaxed. If countries need to return to a greater level of physical distancing due to a second wave of cases, that may be harder to implement mask wearing and social distance, respectively, than it was when mask use was low at the start of the pandemic. So our finding appears to be a classic case of risk compensation, in which decreased risk from one intervention, for example, you wear a mask, you feel more protected, and you see other person being more protected, is accompanied by increased risk from another behavior, such as you decrease the social distance between you and the other person. So risk compensation in general occurs when people respond to a perceived reduction in risk brought about by safety intervention, for example, better car brakes, by increasing the riskiness of other related behaviors. For example, you drive faster. So this is really important for messaging. Mm-hmm. And from a psychological perspective, the theory is that people have an optimal level of risk they can bear. So if an intervention reduces overall risk, for example, wearing a mask, people will take other risks until they return to this tolerated risk level. So we need to be careful about the side effects of actually wearing a mask on social distancing.
Fascinating. So maybe the whole thing, I mean, we'll definitely get into this, but the idea that when you wear a mask, you think that it's almost like a magic shield and therefore you're going to be okay. And I think we'll definitely come back to that. But as an expert in behavioral science, how would you persuade people who now see mask wearing as a political choice, a choice that's kind of intrinsically linked to their liberty? How do you persuade them to wear a mask?
Well, a choice that is intrinsically linked to one's liberty has been the dilemma whether to smoke, especially in public places. So we have lessons learned on this topic, which boil down to first introduce law or government advice, then establish social norms. So the Imperial College London COVID behavioral tracker showed us that the single biggest influence across all reasons of face mask wearing appears to be the law. This is well illustrated by the infection point in the UK when compulsory mask wearing was announced. There is also clear age effect. In Europe and North America, compliance increases with age. We have observed that younger people are actually less likely to comply. Not personally having symptoms is a top reason for not wearing a mask, as is lack of belief in mask efficacy. Asian countries are the most face mask compliant. Numbers exceed 50%, for example, in every category. And Europeans are more affected by than North American peer pressure. Others not wearing a mask, other people thinking they would have it, for example. In contrast, North Americans, however, are far more likely to question the value of wearing a mask. So for them, we need to stress public health messaging about the effectiveness of masks, about perceived susceptibility to COVID infection and perceived severity of COVID symptoms. What we found, however, from the first wave of COVID is that protect yourself messages will have limited impact for the general public because many consider themselves at low risk. They're overconfident. They underestimate the risk to themselves from COVID-19 infection, and they're likely to be persuaded otherwise. Of course, this might be different for those with specific vulnerabilities who are asked to shield themselves for extended periods of time. So in general, there are do's and don'ts that the government should follow in this respect, which I'm happy to share. In order to, the key here is to motivate and to enable. Think about what information people need and how to motivate them and how to ensure they can make the change, in this case, wearing a mask. And so to motivate, for example, the government needs to stress how desired behaviors protect the most vulnerable, including those we love. We have to present powerful images and the actual voices of those we need to protect, loved ones, the vulnerable. And we should not show that often a minority of people are doing the undesirable thing, for example, not wearing a mask, which only reinforces the wrong social norm. And we need to communicate how our sense of self is rooted in membership of families and neighborhoods and communities. Protect each other messages are promising in this case because they're built on on promoting our collective identity. For example, fellow Londoners, members of our local community, and so on. And wearing face masks outside of the house could complement existing government messaging of social responsibility if communicated alongside the effectiveness of masks in protecting others who are not infected. And well, wearing face masks could demonstrate that an individual is concerned for other people's welfare and is enacting desired social norms around safety and hygiene. And the second component I'm finishing here, to enable the public, which is the second biggest pillar of successful behavioral change, we should not give vague advice or suggestions. Be precise. Give precise about what behavior is needed and present examples of what following the advice or not following the advice looks like. So tell people that what support is available to help them adhere with face mask wear and so on. And we need to recommend that the public wears face masks in the community and what could go wrong with wearing a face mask, what guidelines are available and what is the rationale. We need to educate and train the public in terms of when and how people should wear masks and when and how to dispose the mask, any risk associated with their use, and such practical things.
Great, thank you. Plenty of food for thought there. Thank you, Ivo. So we've heard from our experts. Now let's hear from our panel. So welcome to our jury of 12 upstanding members of the Wish community. I think we might even have 13 tonight, we're very lucky, who tonight are actually sitting down and being forced to stare into their laptop cameras. If I could ask you all to raise your hand if you have something to say, either a comment or a question for our expert, Ivo. And if I could ask you to be brief so that we can hear as many viewpoints as possible, and don't forget to unmute your mic before speaking. So, panel, do I see any hands? If I don't see any hands, I'm going to start coming to people directly. There we go. I see a hand in the middle. I recognize the first face there. I see a few hands now. You see now everybody's keen to join in. Person in the middle who I do actually recognize, the 13th person who's our interloper, Sulfa. I should know your name by now. Sultana Afdal, my boss. So she's the CEO of Wish. Sultana.
Hi, Ivo. So my question harks to the political divide when it comes to the wearing of masks. I will put it, focus on America because it's an easy case for me to, cite. So with over 60% of Democrats believing that a mask should be worn and less than 20% of Republicans believing the same, a YouGov recent poll, a CBS YouGov recent poll also cited that 57% of Republicans believed that the deaths from COVID were at an acceptable level, whereas less than 10% of Democrats thought the same. So when it comes to the wearing of masks, I can more or less understand the political divide would be with the messenger, but when it comes to deaths, I'm quite confused as to why they're not persuaded more by medical evidence than political persuasiveness. So that's where my question is. When you look at it from a behavioral insight perspective, how has that medical advice been superseded by political political parties, basically? So if you're a Democrat and you believe a certain thing, has behavioral insight not been able to, I really just want to see. I suppose I'm not phrasing this question very well.
Yeah.
Why is it that medical advice doesn't supersede partisan political divides, I suppose?
Well, I mean, the key finding from
Thanks,
the
Sultana.
survey.
Ivo?
Thank you very much. Thank you, Sultana. It's actually a very good question about why the communication about the benefits of wearing masks, about the epidemiology around COVID is not penetrating the specific political group that we are discussing, the one that you mentioned, the right-wing MS society. So what we found from the survey, and I've seen that again and again in other COVID-related behaviors, is that response to all this messaging from government, from health authorities, is actually contingent on trusting government and trust in health authorities. If people don't trust the authorities, they wouldn't listen to the advice. And what we found with COVID-19, there's a lot of conspirative thinking going on in specific community. The infogenics, which is spreading around false messaging and false stories. As you know, the information pandemic is quite prominent, especially these kind of groups I found from the research from WHO and others. So basically, if there is an explanation behind, if these people have a specific reason to not to believe these messages, for example, because of other explanation why the government is sending these messages, for example, to suppress us and to oppress us, and because of hidden agenda that the government might have, which these communities might believe, then they wouldn't trust the message, they wouldn't follow the advice. And that is not only actually related to face mask wearing, it's also related to social distancing and staying at home, which we see now in other countries as well. Trusting government and trusting the health authorities is the key variable explaining these behaviors. And the Republican Party, I'm not sure some members of it actually are helping in this respect, who explicitly communicate to the public not to trust the media and health authorities.
Thanks, Ivo. So I actually want to go, I think, you mentioned there the US. Do we have anybody on the panel who's in America at the moment? Do we have anybody in the US? We do. There's a hand. So as somebody who's in the US at the moment, you, I think, have been in the thick of this politicization of mask wearing. What's it like from your perspective over there? What are you seeing? The way things have developed over the last year, leading up to the election, of course.
Absolutely. It's been very divisive. It has become a political issue, and it's become a political issue because of the leadership. So when you have the leadership of the country make it political, it does become political. And I think the question goes to, well, why did the president make it a political issue? And is it an issue of masculinity? Is it an issue of maybe downplaying actually the severity of the virus, when he compared it to the flu? Is it an issue of having people focus on other things and not drawing their attention to the pandemic? I mean, there could be so many different reasons why the leadership or the president decided to kind of take that stance when it came to wearing or not wearing a mask. I think also at the very beginning of this pandemic, there was a lot of messaging issues that happened. Wear a mask, don't wear a mask. There's not enough, protective gear for our healthcare workers. It only protects people that are from getting a virus. It doesn't protect yourself. And so a lot of that mixed messaging also led to the distrust that people felt from what we were hearing as people. It also became extremely related to the campaigns of these two individuals. Joe Biden made a very big effort to make sure that he is wearing a mask. He's always seen campaigning with a mask. Democrats are promoting kind of the use of protective gear, whereas the opposite, happened with the Republican Party. If you watch the news right now, even daily, the local news will show you people in the hospital coming off of ventilators, still believing that some of this is a hoax. And the healthcare providers are boggled by it. They're saying, how can somebody be sick with the virus and still not believe that the virus exists. So, I think misinformation, the politicizing by the two candidates, the pandemic happening during a campaign year, the president and the way that he took kind of a stance at approaching the pandemic have all really impacted the public's kind of digestion of this the mask wearing and to wear or not to wear a mask.
Mm-hmm. So thanks for that perspective, because I think the other side, if we look at what's happened in the US, and obviously led by President Trump, the other side of things, I suppose, is the WHO perspective. And even there, though, it wasn't. I think it was early June when the WHO said that it was the right thing to do to wear a mask. Does anybody think here that was an issue, that they were right to wait, or they could, because I know it was based on evidence that's why they said they were going to wait? I see Ramadan. Do you have any thoughts on this, or anything else you want to bring in? I don't want to kind of put you into a corner.
Yeah. Hi, my name is Ramadan. I run my own, I call it a think tank that mostly work with decision makers and policy makers around global health, global development, especially in the line of innovation, and of course, which is a partner and a family for me, that we've been, working in different issues. I have done works with WHO, but I can't speak on their behalf. I don't work for them. I think I have a few observations. Maybe I'll throw a question at the end of it. I think the issue with mask has been, the whole COVID-19 has been heavily infected with the fact that in 2020, average individual, whether they live in the most far part of Asia or in Africa or in Europe or US, are mostly influenced with social media. And I think this has been a little bit of a platform that the policymakers were not prepared, how fast this social media would affect the opinion and develop a certain understanding, even among professionals. What shocked me, I work with, like I mentioned before, with a lot of global health organization, and some medical doctors reach out to me as late as in June and ask me if there is a hoax and this is just a process to do this vaccine with every individual to digitally control them and all of it. Medical doctors asking this question and referring to some stuff he saw in WhatsApp and in the social media. To the conclusion on the side, or the question I would probably throw here at the panel, is how much the policymakers have to come down to understand the impact of social media and more or less partner with this platform. I know there is a lot of effort right now happening with Facebook, with WhatsApp and others, and WHO even engaging with them to try to somehow control those fake news and feed into kind of as accurate as possible, the issues around, how accurate the mask prevent you from, getting infected or infect others. But still, it's so far away from being, I would say, trusted platform, so forth. So the question is, what could be done in social behavior among individuals, among community, but also policymakers who could work with countries and so forth. On the issue of the hesitation around wearing the mask, I think there has been some confusion. There is an issue around whether this is a respiratory infection or not. It would go through the just engaging with people who are nearby 6 feet away from you or not. But frankly speaking, I think that hesitation has been, I would say, extremely affected, what we see right now and where things are going. I don't want to blame certain organization, but there has been no collective voice in trying to clear this at the very early stage.
Mm-hmm. So, does anybody, thanks Ramadan, does anybody in the panel feel that they've been affected by social media, that they, or rather, is there anybody there who isn't somebody who believes that masks are a good thing to do, wearing masks are a good thing to do? Is there anybody who would say that? Who would? Oh, somebody there. Hector, please. Do unmute yourself and speak. Hector.
Hello. Hi, my name is Ekta. Masks, I feel, are a very simple thing, just a piece of a cloth that has two stretchy bands at the end. Just put it on your mouth to cover your nose and mouth. Although experts have highlighted many times that wearing mask is mandatory in areas where social distancing is not possible, still people are not ready to wear masks. They are ready to risk their lives. What I feel is, to a great extent, the onus lies with the health experts who did not highlight the importance of wearing masks at the right time, when the pandemic began. So if it would have been highlighted at that time, people would have been more aware and they would have taken it more seriously.
Thank you. Thanks for your opinion, Hector. Appreciate that. And a very brief answer, which is great. So, gentleman there with wearing a jacket and a white shirt, very well dressed. Just raise your hand if you, yes, if you want to speak. Unmute yourself, please. Yes, unmute yourself.
Go
ahead.
My name is Dr. Mazam Shtawi. I'm a director of women's services at Al Ahli Hospital. I want to touch upon a point raised by Ivo about human behavior and trust in government. While we believe in strong health systems in high-income countries, I think the trust between the people and the governments in some low and middle income countries, the trust has been broken. So there has been no trust. And that sometimes led politicians to cover for their failures or to cover for a bad economy, that they do not want to send clear messages about the importance of wearing masks. So at the beginning of the pandemics, many countries were not prepared for a statement to say everyone should wear masks, either because of lack of resources or either because of inability to get hold of some masks. And that kickstart sort of made many people to be lax about wearing masks. Now, if you look at the people from the other hand, I see some abnormal behavior in terms of some people are wearing masks because of the law and because they have to do it, while in fact they're not wearing masks. They are wearing like half masks, covering their chins, leaving their mouth and their nose open, and I think that is really abnormal. And the last point is, I see it more and more. People at the beginning of the pandemic, some of them were very stringent, religiously wearing masks all the time, expensive ones, and now they're feeling fed up. They say, okay, I'm fed up, I just wanted to relax about it. So, Ivo, what do you think about that?
Well, as I said before, we need to do two things as government when we're trying to persuade people. One is to enable them. The second is to actually motivate them to do what we ask them to do, in this case, wearing a mask. And when we're talking about enabling, it's about communicating the right instructions, how to actually wear the masks in the appropriate ways. So it's like improving their capability to execute the behavior. When it comes to motivation, messages should link to the sense of duty, solidarity, and inclusion. And we also should communicate messages coming from the voices representative of and trusted by the local community. So when, for example, we are lacking trust in the health authorities and in the government in general, as you mentioned, in specific countries and regions, and that definitely happens in the UK, as I observed myself, what we need to do is find the local messenger and the local trusted person that actually can influence people to change their health behaviors. In our situation, we found that, for example, receiving a text message or a letter from your personal GP, not from the health authority locally, is actually influencing people to change their behaviors and turn up for health screening, such as health check, which is a national health check screening for various risk-related factors, cardiovascular disease, and also cancer screening. So when women, for example, receive a letter from the health authority about cervical cancer screening, say they're less likely to turn up on their appointment compared to when they receive a message or a letter from their personal GP, which we show is actually drastically increased the likelihood of them turning up for cancer screening. And now this is a national policy, text message from your GP, not from the health authority. So find the local messenger, a trusted person, usually it's
Ivo?
the doctor or physician.
Ivo, I'm really sorry. We've run out of time. But I feel that we've ended on a reasonably good note there. I'm really sorry for those of you I couldn't bring in. We're going to try and bring you in again tomorrow. We're back again tomorrow. So thank you for being part of this session. I hope you've enjoyed the debate. That's it for day 3 of Wish 2020. We'll see you here again tomorrow. Until then, that's it. Goodbye.